Hi there, we're going to have a look today at some exercises for a herniated disc in pregnancy. So, one of the best things we can do is come over onto all fours. And as you come over onto all fours, the weight of your baby and the weight of your belly is supported by gravity, which is going to soften the lower back muscles and mean that they can release their grip along the length of the spine, which will give a little bit more space for your disc and the discs in between the vertebrae to plump up and hopefully to draw some of the disc tissue back into the area between the vertebrae, as opposed to when you're sitting or standing like this, when all the pressure and all the weight is in your back with your belly in front of you. So obviously you're not going to crawl around on all fours all the way through your pregnancy, but if you can take, say, a few times a day to come into an all fours position and to just allow your belly to relax and to allow your back muscles to relax and allow there to be a bit of softness in your elbows and in your shoulders. So breathing, feeling that you can breathe deep down into your belly as though you can just caress your baby with the inhale. So feel as though your breath just touches your baby as you breathe in, and that you can soften a little bit as the breath moves out. Shoulders relaxed, staying with an even, easy flow of inhale and exhale. And then we're going to start to circle the hips a little bit all the way around. So we're just releasing any tension or pressure in the lower back, in the belly, in the pelvis, down through the base of the spine. Inhaling half a circle, exhaling half a circle, so the flow of your breath matches the movements. Keeping the toes soft, slowly unwinding through the whole of the back. And we're gently opening into the hips, working into the areas of stiffness or tightness through the shoulders, through the hips, through the wrists and through the knees. And just easing out through the pelvis and through the back. And then let's take those same circles in the opposite direction. So again, just unraveling the spine. Inhaling half a circle, exhaling half a circle. And these small movements just help to release pressure or tension in the lower part of the body itself. Again, letting the abdominal muscles relax, letting baby be supported in the hammock of your belly. And as you find those same circles moving around, let's take the right leg and bring the sole of the right foot out to the side. So depending on how far along you are through your pregnancy, you may find that you can get your foot further up, you may find you can get it further in, you may find it's more comfortable to have it further out, whatever feels good for you. And as you're breathing, you're going to circle again. So inhaling half a circle, exhaling half a circle. You're just unraveling through the hips, through the pelvis, through the back. And here we're creating space in your back. Again, we're releasing and reducing any compression through the back of the spine. We're helping the hips to become more mobile so that if you have a natural birth, it should facilitate an easier delivery, having slightly more open hip muscles and slightly more pliable hip flexors. And we can rock forwards and back a little bit, just easing out. And then we can come all the way up. So lifting up and through, hands onto your belly, particularly if you're towards the end of your pregnancy, or just onto your hips, move forwards and down. So we're trying to get the lower back to hang its way down towards the floor. So we're trying to keep the pelvis just scooping in and under. So it's as though your pelvis is like a pendulum and the whole of the lower spine just drops, and that will create more space in between the vertebrae for the discs. Often in pregnancy, you have a posture with your tummy here, bottom sticking out, and chest and shoulders moving forwards, which again is just compressing. So the more we can have that sense of reducing tightness in the back of the body, the easier it'll be for you. Let's come all the way down onto the floor, so coming all the way back to all fours. We'll step the left foot out towards the left hand side, sole of the foot coming down, and again further out, further in or further up, wherever feels comfortable. And then again inhaling half a circle, exhaling half a circle. Easing round and out through your back and through your spine. Elbows and the shoulders soft. Gently working your way through any knots or niggles or places of tension in your hips, feeling a little more openness in your lower back. And you can rock forwards and back as well to start to really stretch the outer hips and to create a little bit more space through the base of the spine. When you're ready, as you breathe in again, coming all the way up, get hands onto your tummy or your baby or hands onto your hips. And we'll just slowly find our way and moving in, and in the exhale dropping down. So trying to find the deeper stretches that you can that feel comfortable for you. Keeping the lower back nice and broad, pelvis just hanging towards the ground. And then when you're ready, you're going to lower both of the knees all the way down onto the floor. Bring the hands down. We'll bring the big toes together. Spread the knees wide so they're about the same width apart of your mat, or at least much more open, so that you've got plenty of space for your belly, so that we can come down onto the forearms. Let the chin drop in. Let the crown of the head be heavy, and let the back of the neck be long. We're going to take a few moments just to breathe here, and to breathe into the back of your lungs, to breathe into the back of your spine. And if you want, you can have a little support for the head by resting the forehead onto the hands, or you could rest over a yoga bolster or a few pillows. And just take 5 or 6 really long, really deep breaths. And just watch the skin on the back of the body stretching open as you breathe in and softening as you breathe out. Taking a little bit of time just to breathe and to relax and to release any pressure or tension through your back into the exhale.